Hospital workers in our region have started receiving the second dose of the COVID-19 vaccine. So when are they actually immune to the virus, and can they still spread it to others? Kayla Green asked a doctor these questions and filed this report for us.
Doctors say immunity is achieved about 2 to 3 weeks after receiving the second dose of the COVID vaccine. However, that doesn't mean you can't transmit the virus once you're immune. Dr. Amelesho is an infectious disease specialist with Rochester Regional Health.
The ability for the vaccine to prevent transmission has not been studied in the vaccine trials. That's not what they're designed to do. What you know from getting the vaccine is that it has a very good ability to protect the person who got the vaccine from getting COVID.
He says as the vaccine rollout is happening slower than anticipated, even those who are vaccinated could transmit the virus to those who are still vulnerable. Achieving herd immunity is when we'll be able to let our guards down.
Once about 85 or so to maybe 90% of everybody that lives in the community gets the vaccine or has immunity, then that's when we're going to be at that herd immunity level.
Dr. Lesho says something else we're not sure about yet is how long immunity lasts and how often we'll have to be vaccinated for COVID-19.
We don't know if it's going to be like the flu vaccine, where we have to get it every year. We can be reasonably sure that we are protected, fully protected from the vaccine for at least 90 days. And how do we know that is because it's very rare for us to see people get COVID twice reinfected within that 90 days. It may be longer, but that's the evidence that we have.
Dr. Lesho says it's hard to tell at this point when herd immunity will be achieved, and until then, everyone should continue wearing their mask and taking all the other precautions. In Rochester, Kayla Green, News 8.
Kayla, thank you. Dr. Lesho says we usually don't know until about a year later how effective the flu vaccine is each year.